I need somebody help, not just anybody help. You know I need someone.
Hi, everyone. My name is Michael Nguyen. I'm one of the chief residents at the University of Toronto, or as Mike Wan likes to call me, Little Mike.
Hi, I'm Tiu. I'm an oculoplastic specialist in Toronto.
My name is Hannah Chu, and I'm a comprehensive ophthalmologist in Brampton and Vaughan.
Just give me a reason, just a little bit's enough. Just a second when I broke.
One of the reasons why I love ophthalmology must be the efficiency. Not only are the clinics efficient, we can see 40 to 80 patients in a day. Our ORs are very efficient. It's rare for one of our surgeries to go past an hour, and that's for the more complicated cases. Cataract surgeries can be done often in about 10 minutes. So it's really gratifying and rewarding to be able to take care of so many patients and to see them all, or most of them, get better.
I chose ophthalmology because I liked the mix of medicine and surgery, and I loved the variety of surgeries that you can do. I also like the lifestyle that you don't have to get up in the middle of the night, and that the call was not too onerous.
One of the reasons why I chose ophthalmology is because as a surgical specialty, there is a lot of medical intervention that can be done in the office to help patients. For example, intravitreal injections to treat age-related macular degeneration, or lasers to treat retinal tears.
So one of the things that got me interested in ophthalmology at the beginning is that it's one of the areas in medicine in which you can directly improve people's lives. Everybody uses their eyes all the time, and if they have a problem with their eyes, it's extremely distressing. In ophthalmology, not only can you diagnose and figure out why they have vision loss, you can do something about it, with all the treatments we have, with the medications, the lasers, and the surgery. And it's an improvement in quality of life. You're able to make a big difference in their lives. And there's a lot of challenges, and people are appreciative. So I'm always very satisfied when I'm able to help people out.
I can see clearly now, the rain is gone.
If I had to give one piece of advice for medical students who want to pursue ophthalmology, I know there are a lot of things that a lot of people will tell you, including myself, but I still think that the most important piece of advice I have ever given, and that was given to me actually when I was a medical student, was to read this one book. It's not what you think it is. It's not directly related to ophthalmology, but in some ways has everything to do with ophthalmology and medicine, and being a human being that other people like and like being around. That book is none other than How to Win Friends and Influence People by Dale Carnegie. This is a very old book. It's one of these so-called self-help books. But I really think that if you take the time to read this book, it will help put into words things that you probably already know. I'm sure you know how to be a likable person. I'm sure you know how to act appropriately in social situations. But this book will really put these things into words. It will help you be able to use these soft social skills in social situations, so that you'll be able to get people to like you and get people to want to help you succeed on your journey to matching to ophthalmology.
Advice for medical students in search of a specialty, I would say definitely find what you love and what you're interested in, but don't get caught up in the competition, or trying to compete for these high power specialties, and don't get caught up in the the martyrdom of the high power specialties either, like the overnight call or operating all night. It seems cool when you're doing it for the first time, but you have to think that you're going to be doing that for the rest of your life. So try to figure out who you are and where you want your life to go, what kind of family life you want, and whether the specialty that you're interested in fits your whole life, because your job is important, but it's only one part of your entire life.
One piece of advice I would give medical students who are interested in ophthalmology, of course, is to do electives and research in ophthalmology. But more importantly is to keep an open mind and learn as much as you can during your 4 years of medical school, because this will serve you well in residency and as a future ophthalmologist.
I think the best piece of advice is to actually spend some time and see what an ophthalmologist does day to day. I mean, you can read about it, but to actually know what those interactions are like, spending a bit of time in the operating room, and all of these things would sort of really help you to see whether ophthalmology is really for you.
Bring me a higher love. Bring me a
One of the things that I'm interested in is pediatric ophthalmology. And that means that one of the things that I love the most about my job is being with kids. Kids are just so funny and they are such a blast to be around. Clinics are definitely high energy, but it feels incredibly rewarding to be able to be with them and their families. Honestly, it feels like I'm playing games all day when I'm in clinic with them.
My favorite thing about the job now is the same thing, the variety of surgery. I love that part of it. And I also, now that I have a family of 4 kids, I also really like the flexibility of it, that you can really choose your own hours and that there are very few emergencies that take you away from your family.
One of the most rewarding things I have found about ophthalmology is being able to transform lives through restoring vision. Oftentimes in the community that I serve, patients present pretty late with vision loss secondary to cataracts. And being able to do surgery to restore the vision is one of the most rewarding things that I found about ophthalmology.
I love the technology, I like the nerdiness of it. I like the precision of the surgery. And I like, that we are, specialized, we are experts. In one area. It allows you to define your knowledge, and it's very exciting. There's always something new coming along. There's things have changed so much since I was a resident, and there's always a new development in the field every day. So if you want something where you can help people, where you can innovate, where you're always having to learn and improve your practice, ophthalmology is for you.
That's it. Good luck.
Good luck.
Good luck.
I can hear you guys. Everybody say,
Are you recording?
Yeah.
Oh, you are.
Getting some deep thoughts here.
You're getting the B-roll, as they say.